Dear gynecologist, how does it feel to be surrounded by meows all day and then interact with in a non-professional manner? Has it ever lowered your libido or made disinterested in someone? Male OB/GYN here. As others have stated, it's all about compartmentalization. At work, I'm just a clinician and it's all business. You have to be able to separate your work from your personal life. If I didn't think I could do that, I would have probably ended up in a different field. Never a time where I would say it lowered my libido, but certainly, there have been cases where I silently gagged and thought to myself, oh God, why? I'm a gynecologist. I can guarantee there is no crosstalk between my work brain and home brain when it comes to meowl exams, surgery, etc. You would go absolutely nuts if you didn't compartmentalize. You're viewing this patient in a purely clinical manner, and you're really just focusing on treating the situation. The exams obviously serve a purpose, so I'm spending my time figuring out if I can feel something pathological, feel a baby's foot, etc. etc. And #X200B, occasionally put off of my lunch, though. Now noticing a distinct lack of gynecologists on Reddit. Not a gyno, but I'm a general practitioner. I do lots of meowl, and rectal, and scrotal exams every day. It's never been a problem for me or my happy fun time drive. I think the human body is amazing in the way that it forms and functions, so I've never looked at genitalia and thought that's an ugly ass meow. Quote, I have thought that's an ugly ass meowl tumor. Body parts are not nasty, their pathology often is. Edit. Thank you, kind stranger, for giving me a skip in my step on the way to work. Female gynecologist here, username checks out. A body part is a body part, the meow needs care like anything else. I personally think smelly feet and weird mouth things are way worse than most meows I've seen. I'm a family medicine physician, so not a gynecologist, but do plenty of meowl exams. I think the overall problem that may lead to decreased libido in this situation is the emotional blunting that occurs during medical school and residency. You see so many sad situations, take on so much stress, and make so many sacrifices that you just become pretty numb and forget how to show emotions, seem interested. Anhedonia is basically baked into your system, which might lead to a decreased libido. TLDR, a lot more complicated than just seeing meows all day. Not a gynecologist, but a doctor who has spent time rotating through OB/GYN. Bodies are bodies, sometimes things go wrong and most of the time disease is gross, whether it's a lung thing or a skin thing or a meow thing. I compartmentalize it to a workbox in my brain because I'm focused on working out what the problem is clinically and thinking about a treatment plan. I can guarantee you that whether I'm examining your meow, breasts, rectum, slong, I don't give a flying fluff about what it looks like and will still eat my lunch and go home and have happy fun time with my partner that day. As a side note, I really wish women would stop apologizing for their bodies to their doctors, nurses. I do not have any expectation that you would have shaved, waxed, and I am aware that bodies grow hair. 0 men have ever made a comment to me about their hairy sacks or erections during my examination. Gynecologist here. It's all about compartmentalizing work versus home, looking at an undressed patient as a purely clinical experience, and it doesn't influence me outside of work. Not everyone can compartmentalize things like that, so it's kind of a prerequisite for the field. I worked in a dissection lab where I watched my friends dissect the meows and slongas of dead bodies. It was fairly easy to disconnect, but I didn't eat meat for like a year. Edit. No, that was not an innuendo. I am a gynecologist, and have 0 libido issues. Mind you, I'm a straight female, so only interactions I have with female reproductive organs that aren't my own are purely clinical. As someone else already stated on this thread, you compartmentalize in medicine. Every patient I see I view 100% clinically, as do all of my colleagues. As a physician, every part of the human body is just a part of a human body. It's not sexualized. I have no idea but was once invited, along with my husband, to a sponsored dinner where a psychiatrist colleague of mine was giving a presentation on mood disorders to a group of OB/GYNs. At this time in my life, I had had 1 baby. The group of OB/GYNs had a policy that during pregnancy you would have an exam with each of the doctors, midwives, so you'd be familiar with whomever was on call when it was time for delivery. So here I was, out to dinner with all of these people. I was sitting there listening to the presentation, enjoying my dinner, when all of a sudden into my head pops, everyone here except for my psychiatrist friend has seen my meow. It was horrifying. Now I can look back on it and laugh, but darn if that was not one of the more freaky moments of a lifetime. And I will smack the person who comments that I should have gone ahead and offered to show it to him, just so everyone was even. One of my friends is a male gynecologist. It seems it's like any other doctor that is affected by work, it's the baggage of what they deal with that bogs them down. One day he asked the group if we can go out because he had to deal with a particular garbage tea day. General gist: he gave us woman with HIV from cheating husband, a pregnant woman finding out results that her baby is not viable and will die, he had to drain an abscess in a particular type of infection. But we did have a talk that he really doesn't sleep around because of what he knows about all kinds of meows. I don't think that's abnormal. I get tested and expect partners do the same. Not a GYN, but I am a nurse. On my most catheterization day, I cathed 4 men and 1 woman. For those keeping track at home, that means touching and cleaning and shoving things in 4 different slongas. Still went home and fluffed my boyfriend, because once the scrubs are off and my normal home clothes are on, I'm not at work anymore and can turn my work brain off. I will say it's weird seeing my boyfriend at work, and it feels odd to kiss him, because when I'm working I'm in work mode and can't be not professional. True story: 30 years ago I worked at a bookstore and my wife's OB/GYN, who had delivered our daughter just 1 month prior, walked in and purchased an issue of Penthouse magazine from me. He didn't recognize me at all, or if he did, he played really cool at pretending he didn't. Gynecologist in my hometown had 10 kids, so it evidently didn't kill his libido. Versions of this question that nobody asks: dentists and dental hygienists, do you still like kissing? Gay, bi, male gastroenterologists, what are you thinking about my husband's ass? Cosmetic surgeons with prosopagnosia, WTF is up with faces anyway? So I was a medic in the army, and I worked in a women's health clinic for a while. Also in my general family clinic I worked in, I was with the only female provider in the clinic, so we often got female patients referred to us. Regardless, I was a very soldier, and I got a lot of skills taught to me, and was eventually doing well women's exams on my own. So while I'm not a gyno, I played the clinical role of a gyno relatively often. I'll kind of give the answer you're looking for: I worked with the healthiest population in the world. My soldiers were mostly 18-19s, young 20s, they were mostly fit, healthy, and in shape. Many of them were good looking, and because they're healthy most of them don't have crazy things going on with their meows, they're seen for annual exams 90% of the time. To make things worse, many of them were my coworkers, meaning I saw them on a daily basis outside my clinic, I saw them in PT, I saw them in classes, I saw them at briefings, and we went out and partied together on weekends. So the compartmentalization everyone is talking about was very important, but also kind of difficult. I never negatively impacted my libido, and I'd be lying if I said that when my doc told me, SPC. Smith is coming in at 13:30 for her well women's, if you can take care of them, the little voice in my head didn't go, fluff yeah. It's worth noting I was married at the time, so straying thoughts were irrelevant because I'm not a cheater and the stirrups aren't the best place to ask for someone's number regardless. But, when the patient gets to the room, all of that disappears. You've got a patient, someone who is giving a profound amount of trust in you to do your job properly, appropriately and effectively. You give instruction, you're respectful, and you get it done as quickly as you can. I've had patients hit on me while I'm visualizing their cervix, I've had patients smirk when I'm doing breast exams, and I've had soldiers come up to me days, weeks later and mention it. It has made me disinterested in someone in a platonic way. I had 2 soldiers, a male and a female. The female got chlamydia and was instructed not to have happy fun time for a week after treatment. She ignored and BF came in with chlamydia a week later. He was given the same instruction, ignored, she came back a week later, vice versa vice versa. We ended up treating them like 4 times and gave a direct order not to have happy fun time under threat of UCMJ. I'm honestly not even sure we were allowed to do that. I couldn't be friends with her after that, just disgusted by how liberal she was with getting a STD. Just use fluffing condoms. So really, the little kid in my brain will always say, it's so cool I got paid for 4 years to palpate breasts and look at meow, but the professional in me was relatively unfazed by on in a day-to-day basis. I took my job as a medic very seriously and had a lot of pride in the profound amount of trust my soldiers put in me, especially when we were deployed. Being called doc, and knowing these soldiers trust you with your life was everything in the world to me, so I would have never tainted it because, haha boobs. I'm a cis, hetero, male gynecologist. Happy fun time is contextual. The context of the exam room, hospital is completely asexual, and so exposure doesn't affect my happy fun time life either way. The call schedule, on the other hand, can definitely make it difficult.